guys, I just wanted to do you a quick video about back pain. What I want to do is to explain to you what chronic lower back pain is. That is CLBP. So chronic lower back pain is something that lasts more than 3 months. That's what chronic pain is, or chronic back pain. Why would that be? So if you get an injury, and we'll say for instance it's a sprain or a strain, it may last only a few weeks, it may last longer. And what I see a lot of is people coming in with chronic back pain, it's going past 3 months and they have episodes of that pain. What we know is that 90% of that pain is from a previous pain or a strain. That could be a muscle, excuse my writing, it could be a ligament, it could be anything in the back. Disc injury occurs for less than 10% of back pain. And going on from that, 2% is something more serious, which is what we call a red flag, which would be something like cancer, a sarcoma, a tumor, something like that. It's a very small percentage. Other things in there as well are structural changes that happen in the vertebra, but 90% of it is a pain or a strain. Now, there's a lot of information out there about back pain, and there's a lot of scary words and terminology out there. The sort of things we hear are disc DJD. We also hear desiccation. We hear disc bulges, we hear impingement, we hear nerve root compression. So all this terminology doesn't really help a patient, and all the studies are showing that now. So basically what's happening is if you go for an MRI and you see disc bulge, compression on the nerve root, it might be possible that it's causing a lot of pain. It may be causing some pain, but the terminology really doesn't help. And what we know from a biosocial point of view, this means it has a mind-body impact, a psychosomatic impact on the person. So they definitely have pain, and their tissues in their body, for instance, as we're talking about the back, tissues in the body, in the back, they are definitely pain sensitive because there was an injury. But that language then can help carry on the pain. And what do I mean by that? So you think there's a disc bulge, you think something's out of place. Your brain then goes into trying to protect the area, especially for instance your back. And whenever you feel a twinge in your back, then it kind of tightens everything up. And we go into a thing called protective tone. And that's very common. So the back becomes very tight, like a vice grip. And then that stops people from being active and makes them protective whenever they have to bend down and pick something up. And really what we need to do is get the back out of that, caught in that cycle, if you like, a hangover in the system. And the way forward obviously is doing something like physical therapy. There's a very, very small percentage now of people that need surgery on their back. There could be an excruciating pain, and that's the reason why they need it, but less and less, 90% plus now, it's just physical therapy, doing exercises, getting moving again, which is what really, really helps them. So just understand really what back pain is about, and the whole psychological effects it can have on a person. Of course, they can get very down and depressed because they feel like their back is never going to get better again, and it absolutely can. So I hope that explains something about chronic lower back pain and how you can be helped. If you're looking for an appointment and if you're looking for some help with your back pain, my number is 087 943 6093, info@bodymechanics.ie. I hope that helps. I'll chat to you soon. Take care. Bye bye.